Hi everyone, Dr. Nemechek here for another weekly edition of Viewers' Questions Answered. This is for October 18th. Just a quick reminder, hit subscribe so you can stay abreast of all of our new videos. And if you have any particular questions you'd like answered, please go ahead and put them in the comment section and we'll get to them. All right, first, why do you use such high doses of omega-3 fatty acid, DHA, in adults? Well, our whole protocol is based upon lowering inflammation. Some of that comes from the food, so that's the olive oil can protect you in great degree from that. A large amount of it comes from leaky gut, so now we've got rifaximin and inulin. We might use glutamine if we suspect COVID is part of that. And then after you've had leaky gut, a population of white blood cells in the brain called microglia can become permanently inflammatory, so you can actually make inflammation from within the brain, okay? And DHA, the omega-3 fatty acids are molecules the body uses to control inflammation, and DHA is the primary one in the brain. So I'm trying to get a lot of DHA in there. Now, we ended up at these doses because 15, 20 years ago, we were testing the autonomic function of adults. We were trying to adjust inflammation, and we didn't know what to use. We were trying this, trying that, and this was around the time they said DHA is really the major omega-3 in the brain. So I said, okay, we did 1,000, 2,000, 3,000 milligrams of DHA in a group of patients that hadn't really been recovering fully, and the 1 and 2,000s wasn't much different than the standard blend of fish oil we were using, but when we got up to 3,000 milligrams of DHA in adults, boom, huge difference. That's how we got there. Okay, it is the predominant omega-3 to lower inflammation in the brain, and to reverse that inflammation process, you need a lot of it, and it's now been shown these inflammatory microglia that they will become less or non-inflammatory when you have a plentiful amount of DHA. So that's how we kind of got there. I should add the vagal stimulator also helps reduce inflammation of these microglia in particular. Question 2, can constant high norepinephrine levels in the brain perpetuate there's microglia, so this reactive or inflammatory white blood cell type behavior and prevent the inflammation from stopping? Maybe, but we don't know. Norepinephrine levels can actually make your white blood cells in the brain kind of turn on and become inflammatory when you need them, like if you've been traumatized or something like that. But we don't really have evidence yet that if they'll kind of get stuck in that state if you have chronic norepinephrine levels. But the thing is, if you have chronic norepinephrine levels, you have something else going on. And that other process, which is going to be involved with inflammation from one level or another, they could cause these microglia to become permanently inflammatory, like I was discussing in the first question. So possibly no evidence against it, but I think it's not really the point. I think the point is getting the global neurological system to be reduced, and then the DHA and the vagal stimulator in particular are able to reach into those microglia and calm them down. Here's a third one. My child has a laboratory test showing food allergies. Can this go away once SIBO, or small intestinal bacterial overgrowth, once SIBO or dysbiosis is resolved? The dysbiosis is a more vague term about imbalance of gut bacteria. And I'd say yes. I've seen this many times in both children and adults. They'll say they come in, I saw this doc, they did this testing, he said, I'm allergic to all these foods. And they're like, that's all I eat. And actually, what I believe is happening here is these blood tests are measuring the interaction between food particles and your white blood cells, and mainly the white blood cells that wrap around the small intestine. So if you have leaky gut caused from excess bacterial overgrowth, you're going to get potentially some leakage of food molecules in there that will trigger these white blood cells, and then the doctor draws a blood test and is looking at it, and that's what he's telling you. I've had a number of people where they go to the doctor, they say, here, so you can only eat corn, rice, and chicken. That was actually a case. And this one patient hated corn, rice, and chicken and hadn't eaten it before, so that it wasn't showing up on his test. So he eats nothing but corn, rice, and chicken for a couple months, goes back, gets his test done, and then the doctor says, that's weird. All your other allergies went away. Now you're allergic to corn, rice, and chicken. Okay? And it's just what's leaking through. But once you fix SIBO, with inulin, rifaximin, now we got to worry about leaky gut from COVID, so you will use glutamine. That will stop and those tests will come down. Yeah, so I really don't pay much attention to the testing. Now, if clinically my kid eats peanuts and he goes into shock, I don't care what the tests say. Don't give him peanuts. That overrides everything, okay? So I don't want anybody to put their kid on inulin and think that they aren't going to get that serious reaction to peanuts anymore, okay? All right. Do sleep and constipation always worsen after starting the protocol? This is mainly directed about children. And sometimes, I can't really give you a good proportion, but it's not most of the time. I think this is going to maybe fall in the 20-30% range, because back in the old days, I used to see everybody at the beginning, the parents, when they'd start the kid on inulin. So you'd see what was going on. It wasn't common at all. It's just that if it happens, you're more apt to complain about it, maybe in social media, and it seems like it's more common. And yes, that can happen. It's part of the awakening. It's part of inulin or rifaximin healing the gut, and the constipation just seems a little worse after that. But then the nice thing is, parents will say, oh yeah, he wasn't sleeping, he constipated, he might even be a little hyper, but then they'll say, oh, in a couple of weeks it was so much better. So typically it's just a little bump and it's worse, and then you start getting the repair phase within a month and it's going away. So it's not a big deal. Don't let that dissuade you from starting the protocol. What causes postprandial bloating? So postprandial is the doctor's term for something that occurs after eating a meal. Okay? And so what causes the bloating? It's basically one of two things for the most part. So you aren't bloated until you eat, now you're bloated. That's from just SIBO or bacterial overgrowth. And I've had many cases where patients will get like 10 days of their rifaximin, and they'll take that and they're like, wow, just like tons better. Just boom, instantly my bloating went away. So you'll see, because that's the only thing rifaximin can do is treat overgrowth. And then for more sustained bloating that tends to occur, what happens is if your small intestine is going too slow, it gives the bacteria too much time to interact with the food molecules, and the bacteria can grow and make gases and more fluids, and they can cause that kind of shift. So if somebody's fasting, it won't happen, but if they eat, they can get bloating. So it's either SIBO or slow intestinal motility. Now, the slow intestinal motility will improve given time when you use the protocol to just lower inflammation. So that's just a short-term kind of issue. And lastly, I've got, please share your experience with how many of your patients have SIBO, bacterial overgrowth, or Candida, yeast. And so they're saying this, I think, because for a long time, certain providers were thinking, oh, you've got too much Candida or yeast, and that's causing your problem, okay? Everybody has Candida and other yeast in their intestinal tract from their mouth all the way to the end. Everybody, every segment, okay? So it's not that you shouldn't have that. Can some people have more than others? Yes. And my big thing is, what's causing inflammation? Because that inflammation is preventing the body from functioning normally, preventing the body from repairing after injuries, stuff like that. And with SIBO or bacterial overgrowth, huge amount of data that can cause leaky gut, or what we call intestinal permeability, and lots of inflammation, massive levels of inflammation. There is zero evidence that yeast or Candida can do that. Okay, so there's a difference between having yeast or Candida and it being the source of the inflammation. Okay, and I should also throw in here, Don't look at a stool test that's telling you how much yeast or Candida still. It's worthless. Those stool tests looking at bacteria are worthless because they don't tell you anything that's going on upstream in the small intestine. That's where the action is. That's where the inflammation's coming from. All right? Okay, that's all for today. Viewers' questions. Remember, if you got a question in particular, put it in the comment section and we'll get to it. And remember, today is No King's Day. If you got a chance, get out there and protest. And we got to stand up for everybody's rights. You all take care. Bye.